So the procedures to treat sinus disease have really developed very rapidly in a relatively short period of time. So probably about 15 years ago, there were some advancements that were borrowed from the cardiology field, where we started to use balloons to dilate the natural drainage pathways. So it's known as balloon sinus dilation or balloon sinuplasty. In this procedure, we're essentially trying to establish the normal drainage pathways, but open them wider. Some of the benefits of this type of procedure: we're reestablishing normal drainage. It's very minimally traumatic to the tissue, very little bleeding, a very quick recovery. So patients are typically able to resume their normal activities in about 1 to 2 days. And they typically don't require any post-operative or post-procedural narcotic pain medications.
Some of the newer types of procedures that are taking place in this office that I do primarily are sinus procedures. And we have gotten a new state-of-the-art neuronavigation device and system, which has been really nice because it has allowed us to do sinus procedures, more complex surgeries that we once were only able to do in the operating room. And this allows our patients to have a quicker recovery, not having general anesthesia, and get back to work faster, less narcotic medication, so it's been really wonderful.
In the last 4 years, there's been really monumental advances as far as both the technology that we're using in procedures and really the decision-making behind them. We're finding that we can get away with a lot less of the more invasive procedures as long as we're treating the other inflammatory conditions associated with particularly sinonasal problems. On top of that, new advances in technology every few months that we've been fortunate enough to integrate with our practice and be on the cutting edge as far as new technologies.
So for people with runny nose, and runny nose is another term for it we call rhinitis, that can be due to allergy, that can be due to non-allergic causes. And we find that it's really present in a majority of our patients, and it does impact quality of life, always needing that tissue blowing the nose. We're able to address the nerve, the posterior nasal nerve, it's within the nose, and we use the device to freeze that nerve and address it within a few minutes in the office. I'm most proud of helping the wide variety of patients, ranging from kids to adults. I've really gotten to see and develop a relationship with my patients over the years.